The Centers for Disease Control says the coronavirus could soon turn into a pandemic sweeping across the globe, and the U.S. will not be immune.
It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected.
With just 57 known cases in the U.S., the CDC says the U.S. risk is low for now. But employers and schools should be prepared to limit travel and large meetings, allow workers to telework, be ready to close schools or allow internet school work, and hospitals may need to delay elective surgeries. Meanwhile, the virus continues its global march from China to Japan to South Korea to Singapore to Italy. Deserted streets, empty airports, but long lines for surgical masks that are running low. The spike in cases in Italy leading some American universities to suspend their study abroad programs. In South Korea, the first U.S. service member has now tested positive for the virus. The diagnosis coming just one day after the U.S. and South Korea announced they were considering scaling back joint military exercises over coronavirus concerns. In Iran, the country's health minister, who had said the virus is under control as he showed symptoms himself, later announced he too is sick. With a 2% mortality rate at the epicenter in China, the coronavirus seems to be far deadlier than the seasonal flu. But in India, President Trump downplayed the risk.
You may ask about the coronavirus, which is very well under control in our country.
The White House is asking Congress for $2.5 billion in emergency funding to deal with the crisis. Leading Democrats and some Republicans say that's hardly enough. This morning, the world's eyes on a virus that shows no signs of slowing down.